During this COVID-19 phase, the restrictions have been increased over the last 10 days. Basically, in the beginning, it were mainly recommendations. Each city started to put out their own guidelines, and they closed down schools, they started to closing down shops. Now, whole Germany has taken over it. So we are forbidden contact in public and in private. That basically means with your family or the people you live together, you can meet them and you can stay with them in the house, you can go with them outside. But otherwise, if you go outside without somebody that lives with you in the same house, you're allowed a maximum of 2 people that have to keep distance, and the police is controlling it. No parties, nothing else. If you go in the supermarket, the floors are marked so people keep the distance. We have our gas station, our pharmacy open, but they limit the amount of people coming in. So they say it's 1 person per 10 square meter of space of those shops. All restaurants are closed, all hotels are closed, public transport is reduced. So it's quite a big limitation that we're having for our private lives, but it's the sake for all of us. There's no more playgrounds, and you do have to keep a distance. It's not the same over all Germany, because our country states like Bavaria, they can have even stronger laws. So in Bavaria, you're actually not allowed to go outside out of you have a reason. You need to go shopping, you need to go to the doctor, or you need to go to work. Most employees basically are working in home office. I think the main thing we can really do is we need to keep distance from each other. Distance from our patients, distance from other people that we meet. As an ophthalmologist, you're usually working very close up to your patients. So we installed those shields on all our slit lamps. We try to keep the distance, we try to limit the time that we actually spend with each other. In our facilities, we build teams, so each doctor has his team of nurses and technicians that we don't mix anymore. So in case one team has to go in quarantine, there's still other teams that can continue working and can continue to take care of our patients. Currently, we actually don't have any FFP masks, no 2, no 3. So we are working with regular face masks. Our nurses, but more to be a good example, have even stitched their own face masks, also to show the patients, if you have one available, to also wear it. We wear gloves in the clinic, in the facility. We disinfect and wash our hands regularly, and every patient that comes in gets a fever measurement and also gets his hands disinfected. And still, the main thing is, if you keep far away and if you don't spend too much time, the risk is still very low to be infected or to actually infect others. If we talk about ophthalmologists in Germany, it's quite different. Most of them still are open, but especially smaller practices or single-run practices have closed, or the doctors have gone and done their yearly vacation now. It's a difficult situation. For example, the staff that is not needed for the patient care, they now all work in their home offices. But the other ones that we need, they still have to come in and have to help with the treatment and the caretaking. So it's kind of difficult, but on the other hand, our caseload reduced itself a lot, because we have many patients that understand the situation and they cancel their elective appointments anyways. So we don't really have a problem in solving that caseloads. If you look at the whole economy in Germany, it's quite a bit different. So we had the possibility that you can reduce workforce and that the state subsidizes those employees with their wages, but many companies, especially like restaurants, hotels, or like smaller production companies, had to reduce their employees, and they are dependent and will be even more dependent on the support of the country and the government. the last question, what have you learned about yourself personally, professionally during this experience? Well, I do have to say, for me, it somehow came out of nothing. In the beginning, I really thought it just was the flu. And I realized how this pandemic was spreading in Italy and how it crossed the border into Austria and Germany, and that we basically had to start to do something. So the first thing was that I really thought about myself, how important my family and my team is for me. And we tried to take the first measures that those people who had to stay home because of their children could take care of their children's. And the ones that are older and at a higher risk don't have any more direct contact. And we tried to set that up. And luckily I found that I have a good handful of colleagues that really support me a lot at work, and also my wife, that helps me a lot and gives me that support that even during that hard times we can get through it. And you know, we often think we have all those surgeries, all those patients scheduled, and we have to work them off. But actually those patients are not lost. Those patients, they're not running away, they're still thereafter. So we just have to use the time, and instead of sitting and whining and complaining and bitching around that it's such a bad situation right now, I think we need to try to work our way around it, to get back into life and to work with the conditions we have and to continue. And I think that's what I learned about myself the most, is that even in that difficult situation, you can still continue, and there is never a reason to give up.